Chair recognizes the gentlelady from Tennessee. 5 minutes for questions, please.
Thank you, Mr. Chairman. We appreciate that all of you are here. As you've heard from everybody, this is work we have been working on for years and trying to figure out how to best get a handle on this issue and end this epidemic. And it is so important that we hear from you. What I want to start with, and this is to each of you on this panel, are there any existing statutes that prevent your agency, your respective agencies, from effectively responding to the opioid crisis?
Well, Congresswoman, we'd be delighted to work with the committee to look across the range of our different authorities and what more we can be doing. The one that I would just point out in response to your question is we're trying to take some new steps to think about how we step up our oversight in the international mail facilities to target synthetic drugs coming in through the mail. And in this regard, we've worked very closely with Customs and Border Patrol. The commissioner there has been a very good colleague to FDA. But there is the potential that we might want to take a look at some point at some of the seizure authority we have to perhaps make it more efficient to operate inside those IMFs.
Okay, anyone else have any existing statute that is an impediment?
Ma'am, from a DEA standpoint, and I will address what was recently reported in the media, one of our administrative tools, an immediate suspension order, recently came under report in the media. We would be happy to work with Congress, and we look forward to working with Congress with Department of Justice oversight to ensure that from an criminal enforcement perspective, a civil sanction perspective, and an administrative perspective, which are all tools that we use to prevent the diversion of illicit pharmaceuticals, we would be more than happy to work, as I said, with Congress, with Department of Justice oversight to ensure that we have the most updated and applicable tools moving forward to attack the opioid crisis.
Okay, anyone else?
Well, I think that following my DEA colleague, I think one of the issues that becomes very important on the aspect of research is our ability to work with substances that are being abused, illicit substances that are very, very dangerous. And that's important because if we don't understand their pharmacological properties, we cannot actually develop treatments. And one of the aspects on it is that because they are Schedule I substances, then it can become very, very difficult to actually do research on them. So being able to generate a category that allows us to protect the public from these substances but allows us to do that research would facilitate our ability to respond to this.
That is great. And if any of you would like to submit something to us in writing, that would be helpful. And Dr. McCants-Katz, you mentioned, and I will just ask you to submit this in writing, you talked about implementation of 21st century cures. If you will give us your timeline for where you are on that, because, and you can just give it to us in writing. We're all interested in that because that is getting the money out to our states, and that is an imperative for us. Mr. Doherty, I'm coming back to you on the Ensuring Patient Access and Effective Drug Enforcement Act. It required the DEA and HHS to submit a report to Congress identifying current issues with diversion efforts, including information on whether coordination between the industry and law enforcement has helped. And that report was due to us in April, so it is now 6 months late. I sent a letter over this week asking about this report, so why don't you, and Mr. Chairman, I would like to submit for the record the letter that was sent over requesting the delayed report.
Without objection, so ordered.
And what I would like to hear from you is what is the status of that report? You've heard the frustration with this panel for not getting information we need from the DEA. So we're adding this to the list. Where's the report? What's the status of it? When should we receive it?
Congresswoman, thank you for that question. And with respect to the report that you mentioned, DEA has engaged with Health and Human Services on that report. And it is
engaging isn't getting a report to us that is now 6 months late. So when do we get the report?
It is my understanding, ma'am, that HHS has the lead on this report that you referenced.
Have you all submitted your needed information to HHS to write this report?
I believe we have, ma'am. We have been actively working on our part of the report with them.
Okay, thank you. Yield back.
Chair, thanks the gentlelady.